When I bring up Lyme, people get, confused. They don't know much about it. I think it's still not really widely publicly known what it means to have Lyme and what Lyme is and how do you get it and these kind of things. So I think they know that there's something wrong. And even though doctors over years have been telling them, you're fine, there's nothing wrong with you, your labs are normal, they know that something's wrong. They know something's off. They just can't put their finger on it. And most people, if they get a tick bite, they don't even know that they got it because they're so tiny. They don't get a rash. Only about half or less of people actually get a rash from it. It doesn't hurt, it doesn't itch, so if it's in your hair, you may not even notice that you have the rash. And then maybe you get a little kind of flu-like cold illness. You don't think much of it. You think it's just a little virus and it goes away, and so you don't think much about it. It also really likes the heart, so some people have arrhythmias or heart block. And it also really likes the brain. So people will come in with acute mood changes, brain fog, concentration issues, kind of memory, short-term memory issues. But it can manifest itself. It's a great imitator, so it can manifest itself very differently in a lot of different people. No one is the same. But anybody that comes in with rheumatoid arthritis, multiple sclerosis, fibromyalgia, chronic fatigue, postural orthostatic tachycardia, these kind of just people don't have a diagnosis, but they just don't feel well for a long time. You dig into their history, you find these things out, and it's always worth looking to see if that's the cause of it. Because again, it's that why, if we can figure out the why, I don't need to give you all these crazy meds for it. I can treat the why and get you better.
Dr. Casey Kelley, thank you so much for being on High Intensity Health Radio. Before we dive into Lyme and all your specialties that you're treating here at WholeHealth Chicago, which is a wonderful integrative medical clinic, multidisciplinary, let's talk about your background. You come from a traditional medical path. What drove you to integrative medicine?
I went to traditional medical school at Ohio State and had some problems with it. Didn't love it. Part of the issue was we were taught to diagnose people and then give them medicine. And then when they got side effects from that, you give more medicine. And no one was asking why. No one was saying, why does Joe have diabetes? Maybe we should treat that. Maybe you should look at his diet and see what he's eating. Maybe this is causing it. So I started to look outside the box and see what else was out there. I decided to go into family medicine because it seemed like the most general, more holistic place to go in the Western realm. But even in that, I kept looking farther and farther and asking why. Because it wasn't just good enough for me to give somebody insulin. I wanted to know why. So I started going to conferences and reading about it and getting more and more involved and joining organizations that were like-minded and becoming more active in those. And so I just continued to do that along the way and knew that was my path. I always kind of figured that out along the way, that Western medicine, that wasn't my perfect niche. I needed to do the integrative functional side of it.
Sure. I hear that story a lot where people either go into medical school and they know this is not what they want to do and they just pursue it afterwards, or they have some sort of personal story where they have their own illness and they become kind of disenchanted with traditional medicine because it didn't help resolve their underlying issues. Or they had a family member that got sick. That's the pattern that I see. Mm-hmm. So you're one where you knew initially that you didn't want to go down that route. So you graduated from your family medical residency, you landed here at WholeHealth Chicago, and then went deep into treating Lyme disease and complex chronic illness. So talk about what spurred this interest in Lyme disease.
Sure. I ended up at WholeHealth Chicago kind of serendipitously, and found quite a great home here. It's a really unique practice, and we really started to love the patients that came in who had 500 things wrong with them. They've been to 500 doctors and everything was normal, but they still didn't feel well. And the other doctors just said, learn to live with the pain, go see psych. They didn't know what to do. They shrugged and kind of gave up. And those are my favorite. Good, let's dive into this. There's something there. Let's find out why, what's going on. And through that too, started to kind of hear about Lyme at a lot of different conferences, and the red light kept I need to look into this more, because you don't learn about Lyme disease in medical school. I think I remember you get a tick bite, you get a rash, you get 2 weeks of antibiotics, and you're done. And that was it. There's no other education about it except for that it's controversial, so be careful. But you start to see all these patients, and I don't give up easily. So I just keep digging and trying to find out why. And so you start to pick up on these things when you go to conferences, and you talk to other doctors, and you see one patient with it, and then you look again and you see more, and you keep seeing more people with it. You want to know how to treat it. You want to know how to deal with it. You want to help people get better. Kind of how I ended up here.
And so let's dive into common signs and symptoms, and then let's go through a workup. So like you mentioned, that patient that has seen all these different doctors and they still don't feel well. What do those people present to you with, and where do we go from there?
I wish I had an easy answer for you, but I don't. There are the acute cases, the random ones that you'll see that have a rash, and we're out hiking the week before, and you're like, yes, perfect. I'm putting you on medicine. We're going to treat this. That one's pretty easy and concise, but that's pretty rare. Most people, if they get a tick bite, they don't even know that they got it because they're so tiny. They don't get a rash. Only about half or less of people actually get a rash from it. It doesn't hurt, it doesn't itch, so if it's in your hair, you may not even notice that you have the rash. And then maybe you get a little kind of flu-like cold illness. You don't think much of it. You think it's just a little virus and it goes away, and so you don't think much about it. So, it can kind of manifest itself years later with all these kind of chronic illnesses. Typically, people will come with a lot of pain, joint swelling. It also really likes the heart, so some people will have arrhythmias or heart block. And it also really likes the brain. So people will come in with acute mood changes, brain fog, concentration issues, kind of memory, short-term memory issues. But it can manifest itself. It's a great imitator, so it can manifest itself very differently in a lot of different people. No one is the same. But anybody that comes in with rheumatoid arthritis, multiple sclerosis, fibromyalgia, chronic fatigue, postural orthostatic tachycardia, these kind of just people don't have a diagnosis, but they just don't feel well for a long time. You dig into their history, you find these things out, and it's always worth looking to see if that's the cause of it. Because again, it's that why, if we can figure out the why, I don't need to give you all these crazy meds for it. I can treat the why and get you better.
Sure. So let's dive into why these people with Lyme disease have so many different symptoms. Like you talked about, Lyme loves the brain. It loves the heart. We know it goes into the joint tissue. Let's talk about the spirochete nature and how is it able to evade the immune system and get into all these different tissues.
Yeah, it's a smart little bug.
Yeah.
It's a smart little bug. I think it's probably one of the smartest bugs that we know of out there. Its ability to adapt is insane. It's so smart. And it has several different forms, first of all. So there's about 3 different forms of the bug, and it lives in different parts of the cells and lives in different kinds of cells, and it morphs and adapts to each cell that it's in. So Lyme bacteria that are in your joints are going to be a little different than the ones that are in your brain, just because those are different environments. So they're going to adapt to that environment. They protect themselves. They form cysts around themselves so they can hide out in the cell and kind of have the immune system ignore it. And they can hang out there for a long time until things are calmed down, then they can come back out. They create biofilms, which are these mucousy, sticky-like substances to protect themselves from the immune system. But they also they actively suppress the immune system. So even if your immune system's trying to fight it, it knows it's there and it wants to get rid of it, but the immune system weakens the force. So the immune system itself can't fight it off. It's a smart bug.
Wow.
It's a smart bug.
So that's called, I think, antigenic shifting. Is that one of the ways?
Yep.
And there's a term, I can't remember exactly, but the bacteria can kind of shed its cell membrane and go inside the cell and invade itself.
Yep.
So when you start to treat it with the antibiotics, then it can kind of move around and undergo these different personalities.
Yep.
Which makes it really complex. And then to add insult to injury, we have the Lyme coinfections. So you could have Borrelia burgdorferi, but have Bartonella, Babesia. So let's talk about then the co-infections now, I suppose.
Yeah, co-infections, I always tell people Lyme is lonely. It always brings its friends to the party. So it's usually someone has at least one, if not 2, kind of bugs hanging out. In this area in the Midwest, we typically have Anaplasma and Ehrlichia, Bartonella, Babesia. Those are the most common co-infections, but mycoplasma and pneumonia is another one that I see a lot. You can have lots of different viruses that come along, Chlamydia, pneumoniae. It can also interact with Candida. I don't necessarily think Candida comes with it, but because of everything that's going on, someone can have a Candida overgrowth issue because of all of it as well. And all of these bugs cause different symptoms in and of themselves, but they're similar to Lyme. And they're similar in the fact that they cause a multitude of different symptoms, and they can all just kind of smolder under the radar for years and cause these issues. And the labs aren't great for it, so as the diagnostician, you have to kind of really look into that history and ask the questions and see what the symptoms are, and then try to fit it with the bugs that may be there.
Right.
Yeah.
Interesting. So any symptoms, we talked about migrating aches and pains, neurologic disorders, heart issues, but any symptoms that really throw off that red flag, we're like, all right, we need to dig deeper.
Anything that kind of triggers me to test for it, it's kind of some of the big autoimmune illnesses. If someone comes in with rheumatoid arthritis, multiple sclerosis, fibromyalgia, I'm going to just kind of test them across the board because it's so common. These cause these symptoms so commonly. It's worth at least trying to rule that out. Sure. Like, okay, that's off the table. But again, it's just these kind of people that come in with these chronic issues that no one can figure out. And it's been going on for years. They can be cyclical in nature, so they can be, every month or so the symptoms get worse, or for kind of no rhyme or reason they get better and then worse. When you're just kind of, you have to start to think about that as an issue. These chronic infections underlying it, irritating the system, causing those symptoms. That go undiagnosed. They fly under the radar and docs don't look for it.
Mm-hmm. Interesting. So do most of these people innately know that they have something really complex going on like Lyme? Do they come in asking to be tested for it, or they just think like, man, I'm a mess from maybe genetics or chemicals or whatever?
I think that's more of it.
Is it?
Yeah. When I bring up Lyme, people get confused. They don't know much about it. I think it's still not really widely publicly known what it means to have Lyme and what Lyme is and how do you get it and these kind of things. So I think they know that there's something wrong. And even though doctors over years have been telling them, you're fine, there's nothing wrong with you, your labs are normal, they know that something's wrong. They know something's off. They just can't put their finger on it.
So let's talk about working the patient up. There's a few different labs. Which one do you recommend, and how do we go about that? The
best Lyme test that we have here in the States right now, I think, is the Western blot. And the Western blot is looking at the immune system's response to different proteins on the bug. But you have to use the right lab. These regular conventional labs only look at one strain, and they leave out about 5 different markers for the bug, for lots of political and vaccine issues and other things. Which you can still, I'll still do that sometimes because money issues, and sometimes that's all it takes, because if they're enough positive on that, then it's a positive. But the better labs are the Lyme-specific labs, like IGeneX, that do 2 strains, and then they look at all of the strains of the bug, but that's out of pocket. Mm-hmm. So there's a little bit of money issues there, but that's the best test that we have right now in the States. But you have to look at it, you have to know how to read it, and you have to kind of look at it objectively in the whole picture, and because the CDC has very strict positive results for that, and ILADS is the International Lyme Associated Disease Society, has different, positive results for that. So generally speaking, I'll start with one of those. If I can do the IGeneX one, then that's where I'd prefer to start, because that's the better lab. Yeah. It's going to give us a better idea. The problem with these labs, though, is if you're really sick and your immune system's really suppressed, these labs may be negative, even though you're one of the sicker patients. This is part of the joys of figuring out Lyme disease. So
since you just mentioned that, let's dive into that. So I have MS, RA antibodies, ANA, something like that, depression, fatigue. My Lyme test comes back from IGeneX. The bands are all negative. Where do we go?
Where do you go? Well, there's a couple other tests that I'll check too, to look at the immune system markers, just to kind of see what the immune system's doing, because that can sometimes help too. One of them is called a CD57. It's a natural killer cell. It's kind of a white blood cell. And generally in chronic Lyme issues, it's going to be suppressed. It's going to be really low. And there's another lab. It's actually a comparison between 2. These are complement levels. It's a C3A and a C4A. And generally in chronic Lyme, you're going to see a high C4A and a low or normal C3A. High C4, low C3. And so if I'm suspicious of Lyme and their Western blot's negative, but their immune markers are saying there's something going on, then we might try and treat them empirically. I'll have a conversation with the patient. Look, I think this may be what's going on. Nothing you've tried so far has helped. Do you want to try this route and see if we can get you better this way? We don't have to do antibiotics. We can do some herbs. We can try some other treatments. And then you can repeat that test later. Usually if they're negative because their immune system's so run down, once you start treating them and things start to replenish and rebuild, then you can retest it and it'll actually come back positive.
That's really neat. I've heard of CD57, but didn't know that you could test complement for Lyme. Yeah. That's really great. I think people are going to love that tip right there. So let's talk about some of the herbs and botanicals. So we come back, we just talked about the patient that is not positive for Western blot, but their immune system is suppressed. And what are you doing there? You mentioned just like generally herbs and botanicals, but how are you getting their immune system to kind of wake up or get responsive so that we're starting to see these antigens from Lyme?
Well, I use herbs in combination with antibiotics a lot, but sometimes I'll use them just by themselves, especially in a really, really sick patient. If they're really, really sick, then I'm not sure if their body can handle the antibiotics, because the antibiotics are kind of like a cannonball. They're pretty strong. Yeah. So sometimes starting with the herbs can be nice, because the herbs are antimicrobial, but they're also really immune supportive. So for example, like cat's claw actually supports CD57. So if they have a low CD57, the cat's claw can help build that up. It's also anti-Lyme. So, you can start to use herbs in that sense too, just to kind of, let's try and kill the bugs and increase your immune system at the same time. See if we can get a response from that. And I'm lucky enough to work here at WholeHealth Chicago with an herbalist, Shayna Tully, so I get to learn a lot from her and talk to her, and there's different protocols and different herbalists out there who have a lot of different protocols out there in combination of different herbs that you can use. Drops, pills, the works.
Nice.
Yeah.
So what I hear you saying is you're actually making your own custom tinctures for these people to not only build their immune system, but to help create antimicrobial herbs that will kill the bacteria.
Yeah, we can do that.
Wow. So we have herbs. What about vitamins, minerals, dietary supplements, selenium, zinc, things like that?
Yeah, the basic stuff. In general, I think the most important thing, supplement-wise, when you're in Lyme is the probiotics, especially if they're on antibiotics. Because that's, you've got to protect the good. You know this. You've got to protect the microbiome. You got to protect the good guys. So while you're giving them herbs to kill the bacteria and giving them antibiotics to kill bacteria, or one or the other, you're also going to kill the good bacteria too. So you have to be really mindful of that. We have to, first do no harm. So I think that's the very most important thing that you do, and you really need high doses. And some people also need good yeast and not just the good bacteria. So you have to kind of give both of those. I think that's the most important thing. Hands down. You also need to look at each patient individually and see where their needs are. Most people are going to need a good multivitamin, some fish oil, vitamin D, immune supporter one way or another, maybe some biofilm breaker uppers, like interphase or nattokinase, things like that. There's a lot of different ways you can do it, but you also have to kind of tailor it to the patient. The problem with it is you end up giving them so many different supplements all at once. It's hard to kind of tailor it in, because you're trying so hard to protect their system while you're kind of trying to kill the bugs. Right. So I try to kind of keep it limited and keep it to the ones that are most important, and then you add things on, like if they're still having a lot of fatigue or dizziness, maybe we add erythritol or adrenal cortex or things that are specific for the patient. But the basics, probiotics. That's the most important thing.
So you hit on something that's unique, and you talked about the biofilm busters. What are some signs and symptoms or clinical observations that might lead you to think that someone has some biofilms that are affecting treatment?
I think in general, most people have a biofilm. You just kind of have to assume, yes, the Lyme is smart. Yes, the Lyme wants to protect itself. Yes, you probably have a biofilm. But it's definitely something to think about if you're not quite getting the response that you want from either herbs or antibiotics. What am I missing here? Using something that can break into that biofilm lets those medicines get to the bugs better. So you have a better response. So it's definitely something to look at if they're not getting better. But I think just generally speaking, assume everybody has one and go ahead and treat it.
Right. Yeah. Awesome. Okay, good stuff. Now you mentioned cannibals, talking about the antibiotics, which is a great visualization, gives people an idea. Let's talk, I know the CDC recommends if you do get a tick bite, I think it's doxycycline for 3 weeks or something, which you probably don't think is enough. So let's talk about acute treatment with antibiotics, and then let's get into those patients who have been flying under the radar and they've been sick for years. What's your protocol?
So there's no protocol. There's no protocol because everyone is so different and unique, which makes it so challenging, but also makes it fun. So you kind of have some ideas in your head that you kind of think of, but everyone's so different, you have to really be flexible and able to adapt to everybody. But when you have an acute issue, if you're not allergic, doxycycline's the recommended one, especially in this area because Anaplasma and Ehrlichia are so common with the ticks too, and those are treated very easily with the doxycycline. I would say at the very least a month of antibiotics with an acute bite, especially once they have a rash or response, you can check their Lyme Western blot. If that's positive, then you definitely want to give them at least a month. And then I'd probably transition to herbs for another month or so and just keep an eye on them and watch them and make sure their symptoms are not evolving in any way. And then you're probably okay, but they definitely need to be watched. If they're not getting better, then you want to keep them on the antibiotics for longer, switch to a different one, or kind of reestablish like what else may be happening. But if you're lucky enough to catch it right away, chances are you can treat it within the first month or so.
Nice.
Chronic Lyme is a very different issue. And that requires a different duration of treatment for everybody, a different kind of treatment for everybody. There's no protocol. Generally speaking, you need at least 2 antibiotics if you're going to give them antibiotics. And I do think that most people need antibiotics for at least a few months. Even if you start on herbs, you're going to eventually probably going to need antibiotics at some point. And it varies, but I would say the least I would ever put anybody would probably be 3 months. Oh, wow. And that would be a very quick, easy, I'm better after 3 months, and then I'll switch them to herbs and kind of transition them on. Most people need to be on them for a lot longer, but it varies. It depends on how long you've been sick and how sick you are. So if you've had it for 15 years, chances are you're going to be on them for a while. So get used to it. We're gonna stick this out, and kind of be on it for a while. But you need to use at least 2 antibiotics because there's different forms of the bugs. And no one antibiotic treats all the forms of the bugs. So you have to use at least 2, if not 3, different antibiotics. And there's different ways of doing it. There's some medicines that we pulse, so you take it just a couple days a week. There's some medicines you take just Monday, Wednesday, Friday. There's some doctors will do 3 weeks on, 1 week off, 3 weeks on, 1 week off. There's no right or wrong. It really is going to depend on the patient. Basic ones to start with, doxycycline. That's a really common one. And tinidazole is another one that I use. That's the cyst buster. Oh, nice. That one's the one that goes in and breaks up the cysts. But there's also cefuroxime, clarithromycin. That combination works really well, plus tinidazole. Almost everybody ends up on nystatin too, which is an antifungal. Mentioned that a little bit earlier, that yeast can be an issue, especially when you're on antibiotics. So you have to kind of watch that, make sure they're getting their yeast under control as well.
Right.
But there's several different, there's a good handful of medicines, and it depends on what coinfections you think may be there too, and you kind of add things on or shift things around. If they're not responding well enough, then you can change them to something else.
Now I know why probiotics makes a lot of sense now. All these different medications. So I've heard a lot about tinidazole. Do you want to talk about that?
Sure. Tinidazole is a medicine. It's a cousin to Flagyl. A lot of people have heard of Flagyl or metronidazole. It's used for a lot of traveler's diarrhea and gastroenteritis and that kind of stuff. So same kind of medicine. But what this does is get in and breaks up the cyst. So the cyst is that protective wall that these bugs can, burrow and hide themselves in. And that's the medicine that will get in there and break that up. That's usually the medicine where people feel the worst when they're on it. So that's one of the reasons why I only do it a couple of days a week, to try and give them a little bit of a relief. But that goes in there and breaks up the cysts, so it releases a lot more bugs into the system.
Cool.
And that's when you can use doxycycline or clarithromycin, cefuroxime, something else to kind of sweep the streets.
Nice.
Afterwards. Yeah.
So let's talk about yeast. So we're taking a lot of these antibiotics, maybe we're creating a little bit of dysbiosis. We throw in the probiotic, and you mentioned probiotic yeast, Saccharomyces boulardii. So let's talk about Sac boulardii, and then what are some other signs and symptoms? Because people may have yeast. I mean, sometimes I get a periodic rash that will appear, and I'm like, do I have Candida? Not to throw this all in one thing, but I think Candida is not really as well published or understood, at least in medical literature. If you type in biosis and SIBO and non-alcoholic fatty liver, you can pull up all these studies. You type in Candida, albicans, there's not a whole lot there. So let's talk about your experience with that, signs and symptoms, and what do we do to kind of get rid of it?
Yeah. Candida, as it's Western medicine, thought you're not going to get an infection. I mean, there's a couple things. One, women get a yeast infection, and they get a day or 2 of diflucan, and they're on their way. Or 2, they have something like HIV that really compromises their immune system, and then they can get really, really, really sick with a yeast infection. Candida overgrowth is a different thing altogether, and that's kind of in this integrative functional medicine world. You learn about these things, and lots of different things can bring on a Candida overgrowth. Too much sugar, too much stress, too many antibiotics in your life. Even if it was, back in high school you took tetracycline for acne, that can kind of lead to an issue down the road too. You're going to have a gassy gut, a lot of bloating, uncomfortableness, and maybe worse when they eat sugars or carbs. They can have skin rashes, and they can be anywhere, but can be itchy, cannot be itchy, can be just a skin rash somewhere, jock itch, ringworm, toenail fungus, athlete's foot, you have those things that have flaky scalp, dandruff. That can also be a Candida issue. But they're also going to have brain fog, concentration issues, focus problems as well, because those Candida toxins can create issues in the in the brain. So that's one of the things that you really have to watch for when you're treating Lyme. One, you want to see, like, do they have this before I treat them for Lyme? Do I need to deal with this now? Or if you're giving them antibiotics, you're killing the bacteria, which usually keep the yeast in check. So all of a sudden, the Candida don't have these bacteria lording over them anymore, and so then they can grow. So that's when these symptoms can kind of come along, and that's why most people on antibiotics long-term end up on nystatin as well, to keep that balance. And that's why the good bacteria are important, and also the good yeast probiotics, so the Saccharomyces boulardii. Just to we really need to make sure that the good guys are winning in this fight, so that's where you have to really load them up and be careful, and just watch for it and treat it when it comes along.
Wow. Really well said right there. As you're talking, I was thinking about that we need to clear a lot of this stuff, so then we need to look at the liver. So we know the liver is really important in detox and stuff. So what do you do for the liver, I guess, in terms of do we look at liver function tests, liver enzymes? Should we track those? What are your favorite herbs and botanicals and nutrients to keep the liver firing so that we can clear all this bad junk?
Yeah, the detox is really important in Lyme treatment. As you're killing the bugs, you're increasing all the toxin load into your system. So you have to really work on clearing it out. And you also have to notice too that these medicines also get filtered and changed in the liver. So there's an extra strain on the liver when you're giving people these medicines. So you do have to check them on a pretty regular basis, every month or so, to make sure everything's okay and that grossly the liver is doing well. Right. And if there's things are changing or shifting, then you need to stop the medicines, reestablish, see what else is going on. But just detoxing in general is really important. If they are having liver issues, you can always give them milk thistle, dandelion, these kind of things to help with the liver itself. But there's other detoxes that you can do too. Saunas, hot baths with Epsom salt. There's different ways to go about doing it, but that's one of the very important thing in the process is to pay attention to the detox and pay attention to the body's ability to clear things out. And if they're struggling, if they seem like they're struggling, and that may be that their symptoms are they get worse on the medicine, they just don't clear up, they don't get better, that could be a toxin overload. So giving them much more detox support can help those symptoms as well.
Awesome. And another area that you focus on is the adrenals. I think you've lectured for the American Holistic Medical Association on this topic. So let's talk about your favorites, whether it's lifestyle tips or herbs, botanicals, nutrients to help support the adrenal function.
Yeah, adrenals are so important. I think I call them the governors of your endocrine system. If they're not working properly, no one's working properly, and any kind of stress can affect those adrenals. So you're a stress center. There's little walnut-sized guys that sit on your kidney. They secrete 50 different hormones. They're really important, but their main job is stress. And they're meant to be on and off. Lion's chasing you, lion's gone. But when you have a chronic infection, when you have high stress and you're an anxious person and you've got all these things going on, those adrenals just are on and they're always on and they can kind of blow a fuse. And that can just exacerbate all these symptoms of fatigue and brain fog and irritability. You're running on fumes. You have nothing left to give. So it can be a very, very key point, especially in treating Lyme disease or other chronic infections. You have to really pay attention. It's is their system so depleted, that they're just really running on fumes? And Chinese docs will say they have no qi, what's going on. So you can use medications if it's really bad. You can use Cortef, which is hydrocortisone, in physiological doses if you need to. But I prefer herbs. I would try to kind of give those adrenals those supplements and things that they need to run better on their own. So you can use adrenal cortex, which is just what it sounds like. It's ground up adrenal gland to give the gland the building blocks to do what it does. But there's lots of herbs. Ashwagandha is a great one. Eleuthero is another really good one. Ginseng. There's different ways to approach it. And it depends too, because some people really need that support in the morning, and other people their adrenals don't let go at night, so they really need to let go at night. So they need phosphatidylserine or other things to help calm them down at night too. So those adrenal, it's a balancing act for sure. But I think if you give it the support and you give it the building blocks, they bounce back.
Now you mentioned phosphatidylserine, and I've personally used that, didn't really notice anything. Are you seeing good results clinically with that?
Yeah, and you don't have to be on it for very long. Usually I only use it at night. There are people who use it during the day too, but I'm usually trying to kind of bring down that nighttime cortisol to help people sleep. And usually within a month or two, you'll see some changes, and then you can stop it. You don't have to stay on it for very long. It's one of those short-acting ones. You don't have to stay on it for years and years, but you can always go back to it as well. It also supports methylation, so there's bonus in that. It can help with detox and things. So It's a good one.
So that's a really good overview of the adrenals and different things. Now let's talk about some maintenance for people that have you put them on the antibiotics, the doxycycline, the tinidazole, and say their autoimmunity is resolved, the energy's back, mental clarity's there. What's our maintenance program look like?
Well, typically, right off the antibiotics, I'm going to put you on herbs because they want to just continue. I'm going to push it farther because if you stop it too soon, those symptoms can come back. So I'm going to push it a little farther than the patient maybe even wants to, because they feel better, so they don't want to keep taking things. But no, 1 more month. We're just going to keep going a little bit. So use different herbs to kind of continue the process for a month to 3 months to kind of make sure everything is down, watch their symptoms, make sure they're not coming back, make sure they're still getting better. And then you can really bring them down to just kind of typical standard supplements, depending on what other issues that they may have. Multivitamin, fish oil, vitamin D, probiotics, it's just some good basic stuff. And then you watch them, and they learn to watch themselves. And they can always go back to those herbal protocols if they need to, even if they're like just an inkling, like, I don't know, I'm getting more tired. Go back on the herbs for a little bit, feel better, go back off of them. You start to know yourself well enough, then you can kind of preemptively do that so that you don't get back down to a place where you're so depleted that you need the antibiotics again. So a lot of it too is just the patient getting to know themselves and their body and what their body's telling them and listening to it and doing something about it and not just ignoring it.
Really great information there, Dr. Kelley. Now, one thing that we ask every guest on the show is if you could just pick one lifestyle tip. This could be related to Lyme or not. Let's say exercising 5 days a week, getting 8 hours of sleep, meditating. What's one tip that you wish all the patients that you saw really embraced and incorporated in their life?
Have fun. Laugh. We do not deal with stress well in this culture, and nobody is taught how to deal with stress at a young age. And one of the best ways is to laugh and let things out, and it's on a daily basis. If you can have fun and smile and enjoy your life and let some of that out, you're going to feel better for it. You're going to get endorphins, you're going to feel good. It's an easy way to try and it's too hard for people to meditate for an hour a day. That's too much. But get them to laugh. They can buy into that. You can start with that. That's a good place to start.
I like it. Good idea. We do take life too seriously sometimes, right? Awesome. So based upon what we talked about, you're a Lyme expert. I'm really impressed with all the different testing, C4A, C3A, and CD57. I'm sure a lot of our listeners would like to reach out to you. What's the best way for our listeners to reach out to you and network with you?
Well, you can start by going to our website, www.wholehealthchicago.com. You can email the front desk. They'll get a hold of me through that way. And you can give us a call as well. Set something up if you want to make an appointment or just make a phone consult. That works too.
Great. And you have your personal Facebook page?
I do.
For business?
I do. Yes, Casey Kelley MD has a Facebook page.
Awesome.
You can check me out there.
Thanks so much for being here.
Yeah, no problem. Thanks for having me.